Hello friends and welcome to our channel General Practice Medicine. This is our second video on the common disease that come into the practice, that is diarrhea, the management and important practical tips. So let us begin. So what is diarrhea? It is the abnormal passage of liquid or the unformed stool with the increased frequency, usually 3 or more times. It is called the diarrhea. Here we are discussing the acute diarrhea that is less than 2 weeks. The persistent and chronic diarrheas are different. They are more than 2 weeks. Usually the acute diarrheas are caused by the E. coli, Campylobacter, Shigella, Salmonella, Entamoeba, Histolytica, cholera, Giardia, rotaviruses, hepatitis viruses, and the antibiotics like azithromycin, amoxicillin can also lead to diarrhea. The increased use of laxatives in the increased dosage can lead to diarrhea that causes you need to rule out. Sometimes some food like Bacillus cereus, Staphylococcus salmonella containing food, stall food, if taken, can lead to food poisoning, which is a very important symptom in the diarrhea, acute diarrhea patients. Such patients will come with a diarrhea, vomiting, minimal or no fever with some abdominal cramps after eating some particular food. So, what are the red flag sign which will you pick up that this is not a normal diarrhea, it is somewhat aggressive disease? These signs are the patient with the profuse diarrhea and the dehydration, if the patient has grossly bloody stool, if the patient has fever more than 101 degree Fahrenheit, if it is the diarrhea which is not responding more than 48 hours, if there is a recurrent antibiotic use, if some community outbreak which is going on like cholera or something, then you need to be more vigilant. If the patient having tender abdomen or the severe abdominal pain, usually these patients are elderly, immunocompromised. In such patients, you need to ask them to go for the inpatient management and the IV antibiotics, because they are not your simple diarrhea patients. In a simple diarrhea, you just rehydrate the patient with the ORS solution, one sachet in the 1 glass of water you give, and it will replenish the fluid as well as the electrolytes. Strictly do not use loperamide for the infectious diarrhea with the high grade fever diarrhea and the diarrhea with the bloody would have a blood into the stool. So then loperamide will worsen your disease. Okay, so strictly do not use loperamide in such patients. In normal diarrhea patient, you can give anti-secretory agent, that is resicadrotil 100 milligram 3 times a day. That will lead to the decreased secretions from the gut, and that will lead to the low volume of your stool. That will help the patient to decrease the frequency. Judicious use of antibiotic to be done in the moderate to severe illness, or when there is a febrile dysentery, you can use ciprofloxacin, ofloxacin, you can use cefixime, cefpodoxime, and you can add metronidazole to that if you are suspecting entamoeba. So these are the antibiotics. When there is a moderate to severe illness, you can use them. Uh, you can also add probiotics. That the normal natural probiotic is curd. You ask them, the patient, to take curd in their normal diet. You ask the normal anti-motility agent, that is coffee. You can ask them to have a coffee that will decreases the frequency of stool. So curd and coffee will help into the diarrhea. Then you need to treat the other symptoms of food poisoning, that is vomiting, which has to be covered with the ondansetron. If there is a spasm or crampy abdomen, that has to cover with the dicyclomine or rotavirine. Sometimes we see rifaximin in the prescription. Rifaximin strictly is used for the uncomplicated traveler's diarrhea without fever and the blood in stool, because it's a luminal agent, it does not go inside the body. So it is used with when there is a no fever or the no blood in stool for the uncomplicated traveler's diarrhea. When the patient is immunocompromised, HIV, diabetic patients, such patients can worsen fast, so you need to be more vigilant. You can add antibiotic accordingly and can shift to the IV antibiotics or the indoor management, because they can worsen fast. The management differs, so you can get a test done. They may need IV antibiotics. Cholera, the antibiotics are different. You have to use the doxycycline. If the abdomen is tender or the symptoms are severe, then you can get ultrasound done to rule out the colitis and the other local causes. So basically, for the diarrhea, the take home message is normally you just rehydrate the patient and the patient can be fine. If needed, you add the antibiotics. That is your second point. Third thing you can add is the probiotics in the natural form curd, or maybe the enterogermina, that is Bacillus clausi, and such preparations are, lot of preparations are available. Then you can see for the abdominal sign and symptoms. If there is a tenderness, you get ultrasound and refer to the patient for the indoor management. You can add the anti-secretory agent, that is resicartrotil. So it will go with the with the acronym of wrapper: rehydrate, antibiotics when indicated, probiotics, abdominal sign and symptom, and resicartrotil. So this is about your normal diarrhea management. Strictly again, we are saying that do not use loperamide for the bloody diarrhea, or the diarrhea with the high fever, or the infectious diarrhea. You can use the antibiotic when it is a moderate to severe illness. Look for this red flag signs like profuse diarrhea with dehydration, high grade fever, grossly bloody stool, duration more than 48 hours, if there is a pandemic going on, and if the patient is immunocompromised, diabetic, HIV, and in such kind of patient you may need the stool culture or the stool routine to check for the other causes of your diarrhea, and then treatment differs. So this is about your routine management of diarrhea. Please like, share and subscribe this video, and please let us know in the comment box what videos do you want in future. Thank you.